morning. I said good morning. Do you stand up and wish or no? Good morning, everybody. Please sit down. So today we will talk about malocclusion and edentullousness. So do we have any faint idea what is malocclusion? What is occlusion? What is teeth? Nobody knows what is teeth. This has to be interactive. Okay? You may be right, you may be wrong, but it has to be interactive. I want you to learn and understand. Okay, you may not be having the same topic again, so please try to understand. So it has to be interactive. Okay, do we understand what is teeth? What is teeth? What is a tooth? When you smile, do you see something white? No? Yes or no? So what is a tooth? Tooth is a okay. Now, if you do not answer, I will pick up one person and ask them. Okay, let's start. What is a tooth? Get up and answer. Tooth is a structure which is used for mastication of food. Fair enough. So, is one tooth alone going to do the mastication? Group of teeth. So, what are those group of teeth? There are two groups of teeth which are present in everybody's mouth. The upper teeth and lower teeth, or the maxillary teeth and the mandibular teeth. Okay. Now, are these two teeth just hanging inside the oral cavity? No. There is some relationship between these two teeth. That relationship is occlusion. Okay. The relationship between your upper teeth and your lower teeth, whether in static, like how you are sitting right now, that is static, at rest. What I am doing is dynamic, at function. I'm talking, eating, dynamic, function. So the relationship between your upper and the lower teeth, okay, in static or dynamic condition is called as occlusion. So what do we understand by malocclusion? Now we have understood what is occlusion. So what can be malocclusion? Malocclusion can be a variant of ideal occlusion. Okay. So if somebody does not have the ideal occlusion, it is called as a malocclusion. Okay. It can be a single tooth malocclusion. It can be multiple teeth malocclusion. Okay. It can be a skeletal mal relationship. So anything which is not ideal and a variant of ideal is malocclusion. Now, second thing is edentullousness. What do we understand by edentullousness? No? Nobody can think? Edentulous? Okay. When you have teeth, the teeth is called as dentulous. When a patient has teeth, we call it dentulous. So, what do we think? What would be edentulous? What do you think? If dentulous is with teeth, edentulous would be without teeth. Okay. So it could be one tooth missing, it could be two teeth missing, or it could be all the teeth which are missing in the jaws. Okay. So malocclusion, this is not a disease, but it is a variant of ideal. Now there are two photographs over here. Which one is ideal? The left or the right? The right one is the ideal. So what do we see in the ideal? We see that the upper teeth are overlapping your lower teeth. Okay, yes. And we see a good relationship, a perfect fit between your upper and the lower teeth. So that is your ideal occlusion. It is the harmonious, static and dynamic relationship of teeth and jaws. The ideal occlusion is when upper teeth slightly overlap the lower teeth, fitting perfectly together. And malocclusion, as you can see in the first photograph, is that a proper occlusion? Yes or no? Why? What is the thing which is different in that photograph? Come on, it's right in front of you. The upper teeth and the lower teeth, they are not meeting. Are they meeting? There is an obvious gap between your upper and the lower teeth. So although malocclusion is not a life-threatening condition, it can be thought about as the public health trouble because of its high occurrence. It has the third highest prevalence after dental caries and periodontal illness. So let us first understand an overview how the teeth are developing. So when do we see the first tooth in a baby? When do we see the first tooth in a baby? At around 6 months. Yes. Which is the first teeth to erupt? Lower central incisors. Very good. So lower central incisors are the first teeth to erupt, and then comes the upper central incisors, lower laterals, upper laterals, and then comes the premolars. Yes or no? Yes or no? How many say yes? How many say no? Yes, there are no premolars in a baby. Okay? Premolars are present in adults. So we have central incisors, lateral incisors, canines, and the two molars. Okay? So by around 2 years of age, all these teeth are present in a baby, and the root will get completed by around 3 years. Now this is the time when the occlusion has started developing between your upper and the lower teeth. There is occlusion. So first you will see that all the teeth are having tight contacts. The baby teeth are generally smaller in size than your adult teeth. The final teeth, the permanent teeth, are bigger in size. So to accommodate those bigger teeth, some spaces will start developing between these deciduous teeth, which are also called as the primate spaces. Now this happens by around 4 years of age. So why are these spaces developing? Because your first permanent tooth will erupt at around 6 years of age. That would be the lower first molars and the lower incisors. Now to accommodate these bigger teeth, there are some spaces which are developing in the baby teeth. And eventually your baby teeth will get shed and your permanent teeth will start erupting. So anywhere, if there is a problem in this cycle, in your permanent teeth, you can expect malocclusions. How? Anybody can tell me how? I've just explained you an overview of what is happening in the development of occlusion. Now, if you have nursing bottle caries or early childhood caries, which are mostly developed because of bottle feeding, then your deciduous teeth starts getting decayed. If you're ignoring, then the deciduous teeth will start involving the pulp. It may require root canals, which is called as pulpectomy. Your tooth may also get lost. Now, your deciduous tooth was retaining the space for the permanent teeth to erupt. Now, when the deciduous tooth is lost, that space which was supposed to be occupied by a permanent tooth, it may get obliterated. Your permanent tooth may not erupt. Your permanent tooth may erupt somewhere else. Okay? Are you understanding? So, this is a brief overview of how the malocclusions, they start to develop. So, these are the different types of malocclusions that we come across. The first picture shows an open bite. Open bite basically means in vertical dimension, your upper and lower teeth are not contacting. Second photograph shows a crowding. Crowding basically happens when there is a arch length and tooth size discrepancy. Means your arch length is less, your tooth size is bigger. Then there will be crowding. Spacing, Again, arch length and tooth size discrepancy. Your arch length is bigger, tooth size is smaller. Crossbite. So crossbite basically means your teeth are in reverse relationship. Generally, your upper teeth are ahead, but here your lower teeth will be ahead. Deep bite. So vertically, we just saw that around 2 millimeters, your upper teeth will overlap your lower teeth. But in deep bite, it will be a more than 4 mm. Abnormal eruption, like I just told you, this canine is not erupted in its proper position. It could be because the deciduous canine was removed for some reason and there was no space, and hence this tooth has erupted more buccally. Overjet. So it is the horizontal distance between your upper and lower teeth. In an ideal occlusion, it should be around 2 millimeters. Overjet means excessive horizontal overlap. Reverse bite. When your entire lower dentition is in a reverse relationship to your upper dentition. So the causes of malocclusions are multifactorial, which influences being both genetic and environmental. Some of the causes of malocclusion include heredity. Like we can see in this photograph, what is the thing which is not proper? Which jaw has a discrepancy? Lower jaw. So the lower jaw is bigger. So this usually runs in families. Missing teeth, also called as anodontia. Okay, so it may be a congenitally missing teeth. If few teeth are missing, we call it hypodontia or oligodontia. If all the teeth are missing, associated with some syndromes, we call it anodontia. Certain congenital defects, like very commonly seen, cleft lip and palate. So in such situations, we can always expect malocclusions to develop. Certain proximal causes like habits. Which habit especially? Thumb sucking. How many have thumb sucking habit or had? No one? None? Have you seen some baby doing thumb sucking? So what happens with thumb sucking? Your thumb is exerting pressure on upper teeth and the upper jaw, which causes your upper teeth to flare out, or it may develop open bite. Okay? Biting, nail biting or pencil biting. Postural habits, sleep postures. So that also can cause your effects on mandible and can lead to malocclusions. Mouth breathings and nasal lesions. So if you are a mouth breather, if you are continuously breathing from mouth, you will have a long face. Okay? Open bite may develop. The tongue position may not be normal. Abnormal labial frenum. So what is labial frenum? So if you just do like this, you will see a muscular fold inside. So it is a muscular fold which is called as labial frenum. So if you have thick labial frenum, generally this frenum will attach between your upper central incisors. So if you have thick labial frenum, you may have diastema or spacing between your upper front teeth. TMJ articulation, temporomandibular joint. If there are issues with temporomandibular joint like TMJ ankylosis, if the child had a fall, okay, and one of the joint is ankylosed, it is fixed, then the upper side of the other side is growing, this side is not growing. So it will lead to malocclusions. Abnormal tongue. So if you have like bigger tongue, so it will exert pressure on the teeth and it will lead to malocclusions. Certain local causes, early loss of deciduous teeth, delayed loss of deciduous teeth. So both are going to cause an issue. So if your deciduous teeth or milk teeth are lost early, your space for your permanent teeth will be obliterated. But if your deciduous teeth are not falling off at correct time, then your permanent teeth may just erupt at some random locations. More buccal, more palatal, they may be impacted. Delayed eruptions of permanent teeth. If your permanent teeth are not erupting at the schedule they should erupt, that can also lead to malocclusions. Early loss of permanent teeth. Now what happens? Your teeth are continuously moving. So when you have two set of teeth, the upper and the lower, the position of the teeth is maintained. But for some reason, if your one tooth is removed, let's say the lower teeth got extracted, for some reason, this upper teeth will start moving downwards. Okay? There will be supra eruption. And that space of lower teeth, in that space, the side teeth will start taking the position. So you will develop malocclusions. So if there is a loss of permanent teeth, it should be replaced. Oversized teeth in undersized jaw and vice versa. If you inherit the jaw size from one parent, teeth size from one parent. If you have bigger jaws and smaller teeth, what will be the ultimate malocclusion? Spacing. If you have smaller jaw and bigger teeth, crowding. And dental caries. So dental caries, malocclusions कैसे करेगा? If you have dental caries, it may ultimately lead to extractions. Okay, loss of tooth is there. So your other teeth will start taking the place. So what are the problems that occur due to malocclusions? So most importantly, if you are not having a perfect smile, you will be camera shy. You will not like to smile in front of people. Will you like to smile in front of people? No. So the first thing that is going to affect is your impaired dentofacial visual appeals. Okay? Your self-esteem may get, affected at times, that my smile is getting affected. I'm not able to smile in front of people. People are looking at me. They are observing my teeth. Second important function, if you don't have a proper occlusion, you will not be able to eat properly. Like if you have an open bite, if your upper and the lower teeth are open, will you be able to eat a pizza? Pizza खा पाओगे? No. Because your upper teeth, what is the function of your upper teeth? It is to incise. Your upper teeth are meant for incising. You take an apple slice, you put it, your front teeth are incising it, cutting it. Then your back teeth are grinding it. Okay? Swallowing. You may have issues with swallowing. If teeth are not there, you may have, or if there is malocclusion, swallowing will be a problem. And speech. So there are a lot of sounds that we are making every day. So we have bilabial sounds. Bilabial means, labial means with the help of lips. Bilabial. So which are these sounds? Say p. P. कहाँ से आ रही आवाज? प. 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 म. So when you are pronouncing P, B and M, your lips are touching each other. When you say the, your tongue is touching the upper teeth back surface. F, F, V. So all these sounds, your speech may get affected if your teeth are not in proper position. So less appealing effect on the smile and the face, which lowers the self-esteem and self-confidence. It also influences the oral well-being of children. Now, if children have continuous, malocclusions, because of malocclusions, there is caries, they are not able to eat properly, then it will affect their oral well-being. There may be formation of plaque and calculus, as we can see in this photograph. Okay, when the teeth are not in proper position, it will be difficult for you to brush. When we are brushing and our teeth are not in one line, all the teeth may not get brushed equally. Okay. So what are the symptoms of malocclusion? So if there is malpositioned teeth, which could translate into poorer oral hygiene, as it would be very difficult to maintain good oral hygiene. So what will be the result? Caries. If you have mispositioned teeth, which results in difficult cleaning and plaque control, poor plaque control, it will lead to periodontal disease. If the teeth has increased overjet, we just spoke about overjet. Overjet means the vertical or the horizontal overlap? Horizontal overlap. So teeth overjet predisposes to the risk of trauma. Okay. If your front teeth are more ahead and if you fall, they may just crack. If there is an anterior open bite, then you have masticatory problems. If you have the teeth are not in proper position, then you have speech issues. So there are different types of malocclusion. It could be just one individual tooth. It could be malrelationship of the dental arches, or it could be skeletal malrelationships. Okay. So now tooth has certain surfaces. Are we aware of the surfaces of the teeth? How many surfaces each tooth will have? Okay, so this is your midline. This is how you have the right and the left half. So the side of the tooth which is facing towards the midline is called as the mesial surface. The side of the tooth which is away from the midline is called as the distal surface. Mesial, distal. The side of the teeth which is towards your lips or cheek is called as the labial or the buccal surface. And the side of the teeth which is towards your tongue or the palate, we call it the palatal or the lingual surface. Upper teeth will have palatal, lower teeth will have lingual. So last one surface is remaining which is called as occlusal or the incisal. So posteriors will have the occlusal surfaces, the flat surface, and the front teeth will have an incisal edge. Okay, this incisal edge. So if your tooth is malpositioned, it may be mesial tipping. As you can see in this photograph, your tooth is inclined mesially. It may be a distal tipping. So it is inclined distally. It can be a palatal tipping, inclined more palatally. Labial tipping, inclined more labially. Infraocclusion means it is below the occlusion surfaces, or it could be a supraocclusion. So when can we see a supraocclusion? I just told you. Supraocclusion means, so this is how your teeth will be, upper and the lower teeth. Infraocclusion means this lower teeth is below the occlusal surface. This is the occlusal plane. The lower teeth or the upper teeth is below. Supraocclusal means that one tooth is below the occlusal plane, crossing the occlusal plane. So when can we see a supraocclusion? When your opposing tooth is missing. Then we can expect a supraocclusion or supra-eruption. As you can see in the last photograph. Can you see? So because your lower teeth is not there, your upper teeth has started moving and started taking its place. Then we can have rotations. So it can be a mesiolingual or distobuccal. It can be a distolingual or mesiobuccal, and it can be a transposition. So what is transposition? Transposition basically means your canine has gone in the place of premolar. Your premolar is in the place of canine. Okay, you can see in this photograph, this is your canine which is far away. Okay, this is central, lateral, premolars, and then the canines. So this can happen because of early loss of deciduous teeth. Then you have malrelationship of dental arches. Means one, your lower arch are either placed ahead or placed behind. Vertical plane has open bite or deep bite. We have already spoken. Then you can have skeletal malocclusions in which one of your jaws is having an issue. Whether the jaw is either bigger or the position or relationship is not correct in respect to the other jaws. So now how do we classify the malocclusions? We need a classification because if I am going to discuss a case with you or you have a case to discuss with me, then we should have some way of expressing. We cannot just say that, ma'am, that patient has malocclusion. We have to communicate. Okay, so classifications are made for better communications. So this is a classification which was given by Edward Engel in 1899. And to understand the malocclusion classification, we need to understand the occlusion. What is an ideal occlusion? So in this photograph, you can see this first permanent molars. So first permanent molars are the key to occlusion. So first permanent molars will have cusp. The posterior teeth have cusp. So which cusp will be this? The cusp which is facing towards your cheek would be which cusp? Towards the cheek, which is that side of tooth which is facing towards the cheek. Buccal? Buccal. Okay, it would be buccal for posteriors. And then there are two cusps. Can you see there are two cusps? So which is towards the mesial and is buccal will be called as the mesiobuccal cusp. The one which is distal but buccal, which we known as the distobuccal cusp. Okay. So for class 1 molar relationship, the mesiobuccal cusp of the maxillary first permanent molar occludes in the buccal groove. The lower teeth, all the teeth will have grooves, cusps, ridges. Okay. So this is how an ideal occlusion will look like. So your upper mesiobuccal cusp will occlude with the lower buccal groove of the first permanent lower molar. So this is a class 1 occlusion. So what do we understand by a class 1 malocclusion? A class 1 malocclusion means when there is a class 1 molar relationship which is present in the teeth. However, we can find any type of malocclusion. So what are the types of malocclusions that we can see? We can see crowding, we can see spacing, we can see rotations, we can see missing teeth. Understanding what is a class 1 malocclusion? When your molars are in class 1 occlusion relationship, but your teeth are not in proper occlusion. And then there can be a bimaxillary protrusion in which both your upper and the lower front teeth are more proclined. Like we can see in this photograph. Then we have a class 2 malocclusion. For class 2 malocclusions, there will be a class 2 molar relationship. So class 2 basically means your upper jaw is ahead of your lower jaw. Okay? Your upper jaw is ahead of your lower jaw. So when your upper jaw is ahead, now which cusp will occlude with the lower buccal groove? Which cusp will occlude of the first permanent molar? Your distobuccal cusp. Because mesiobuccal cusp is moved ahead. Your upper jaw is ahead. Okay, so a class 2 molar relationship basically means that your distobuccal cusp will articulate with the lower buccal groove of the first permanent molar. Always occlusion classifications are based on the first permanent molar, which is the key to occlusion. And then there are some subdivisions. So in that, everybody has seen Akshay Kumar smiling. Okay, so you have observed that the upper teeth are more tipped back. Yes. So that is a classical feature that we can see in a class 2 malocclusion. So class 2 has division 1 in which your upper teeth will be more proclined. Division 2 in which the upper teeth are more retroclined. Okay, they are more lingually inclined. And then there can be a subdivision in which on one side you have class 2 and one side you have class 1 molar relation and any type of malocclusion. Then class 3. So in class 3 it will be reverse. Means your lower teeth are ahead. So that means your upper teeth is in place. Now your lower teeth have moved forward. So you can see, so what will occlude? The mesiobuccal cusp will now occlude in the interdental space between your first and the second molar. Okay. So this is how we just classify our malocclusions. Class 1, class 2, class 3. So now class 3 can be a true class 3, a pseudo class 3, or a class 3 subdivision. So true class 3 means actually your mandible is ahead. Pseudo class 3 means the patient has developed a habitual position. Why? Because sometimes the patient has lost the posterior teeth and they have to eat. So they will now adapt. They will start moving the mandible more forwards. Okay. So true class 3 is a class 3 molar relationship in which the lower incisors are lingually inclined, lower tongue posture and narrow upper arch. Pseudo class 3 is caused by the forward movement of mandible, which could be postural or habitual class 3. So how do we manage? So what is our goal of management of malocclusion would be the most important thing that we have to consider is aesthetics, look or function. What should be our goal? Functions. If our functions are getting affected, if we are not able to maintain good oral hygiene, if there are caries which are developing, if the patient complains that I have difficulty to speak, eat, swallow, then that should be our ideal situation when we should think about treatment of malocclusions. Or the patient has some syndromes. Few syndromes like cleidocranial dysplasia, cleft lip and palate, all this will have some kinds of malocclusion. So maintaining a normal equilibrium between the different structures that make the dental unit is essential for normal masticatory process. Thus, any disruption of dental positioning can lead to malocclusion and interruption of mastication. Corrective management of malocclusion is often preferred during the early years of life as it will entail a repair of appropriate occlusion within normal skeletal growth of the body. What do we understand by this? So if when the baby is growing, when the child is growing, your jaws are also growing, right? In an adult, the jaws have already grown to the final limit and then we are doing some changes. So can we affect the skeletal part? No. Why? Because that is already developed. But if the child is showing a tendency of a bigger mandible, then at early stages, if we start our treatment, then it will be more beneficial for the child. The management approach of malocclusion is highly dependent on the type of malocclusion. Milder cases can be treated with orthodontics and if the orthodontics can be of two types. We understand what is orthodontics? We've had dentistry classes. So orthodontics is a branch in which your crooked teeth, they are made proper with the help of wires and braces. Okay. So that is orthodontics. So you can have removable orthodontics, there can be fixed orthodontics. So for most class 1 malocclusions can be treated with the help of braces. So for this, we have to take the impressions, we have to take the radiographs, and then we have to decide on the proper case, because once you start a case, you have to come to the end result. If overcrowding is specific cause of class 1 malocclusion, extractions may be needed before actual treatment process begins. For class 2 malocclusion, they can be improved with braces, retainers, and so we understand what is class 2? What was class 2? The jaw was ahead, upper jaw. But if you have class 3 malocclusions, means your lower jaws are ahead, then if the child is in a growing stage, we can provide some extraoral appliances also. Like you can see in this photograph, this is a chin cap. Okay, this is a face mask. So if you have in growing phase, we can provide these appliances. Otherwise, we can opt for even surgeries. So in dentistry, malocclusion is not considered an uncommon finding. Despite being relatively widespread, it does not pose a serious threat to dental health and thus mostly does not require treatment. Patients who present with craniofacial anomalies that include a severe form of malocclusion are often the ones who will be given the priority. Management of severe malocclusion include orthodontic management and or orthognathic surgeries. So orthognathic surgeries basically means if you have a bigger jaw, okay, then a part of the jaw can be removed and it can be retracted back. Okay. Or if your jaw is behind, we can push it forwards. The therapeutic objective of orthodontic management is achievement of a stable, functional, and aesthetic teeth alignment. This could greatly enhance the patient's oral and overall health and well-being. Any doubts in malocclusion? Understood? So quickly we will do a recap before we move to the next topic. Okay, so the first girl, what is occlusion? It is the space between upper and lower teeth. Who would like to give me a correct answer? What is occlusion? Get up and answer, please. Yes, it is the relationship between our maxillary and the mandibular teeth. So what is malocclusion? So what is malocclusion? Anybody from the boys side, please? What is malocclusion? That was the topic that we have just discussed. It is anything which is a variant of ideal occlusion. So what could be the types of malocclusions? Different types we just saw: spacings, crowdings, increased overjets, cross bites, or did we say open bite? Did we say deep bite? Okay. So it could be an individual tooth malocclusion, it could be a dental arch, or it could be a jaw. Then we have three classifications: class 1, class 2, class 3. Class 1 malocclusion is when your teeth are in a class 1 molar relationship. Okay, and malocclusions can be crowding, it could be spacings, it could be increased overjet. And what is the treatment for a class 1? It can be orthodontic treatment. For class 2 malocclusions, basically means your upper jaw is ahead, your teeth are in a class 2 molar relationship, okay, and that will lead to, that can cause malocclusions. If malocclusions are present, then that can also be corrected orthodontically. What do we understand by a class 3 malocclusion? The lower jaw is ahead. It can be a true class 3 or a pseudo class 3. Okay. So what are the sides of the teeth? Who will tell me all the sides of a teeth? The one towards the midline is called as the mesial. The one which is away from the midline is the one which is towards the lips, one which is towards the palate, palatal, one which is towards the tongue, lingual. Okay, these are all the one which is towards the occlusion, which is or is called as the occlusal surface. Okay, which is causing, which is helping you to grind the teeth. And the anterior teeth will have an incisal edge. So we've understood what is malocclusion. Now we will understand what is edentullousness. So we just spoke about edentullousness. So what is edentullousness? Loss of teeth. Yes. So we have dentulous and we have edentulous. So edentullism or tooth loss is when someone lacks some or all of their teeth. Missing teeth can be detrimental to health as it makes it hard to chew the food and digest it properly. Okay, it could be one single tooth which is missing, it can be few teeth which are missing, or it can be all teeth which are missing. So what are the causes of tooth loss? What can be the causes? One by one, let's see. We'll start from the boys' side. Get up an answer. Tooth loss can be because of trauma. Yes. Next. Tooth loss can be because of dental caries. Very good. Tooth loss can be because of aging. So what happens with aging? Yes, gums will get weaker. What will be the other causes of tooth loss? Infections. Okay, which infections? It can be a periodontal infection. Okay. Next, what can be more causes of tooth loss? So we've seen trauma, we've seen dental caries, we've seen periodontal diseases, aging. Okay, it could be also because of smoking. Okay. So there are two types of edentulosum. One is partial and when there is complete. Partial means when there are few teeth which are missing. It may be in the upper jaw, it may be in the lower jaw, both the jaws. And complete edentulism means when people have all the teeth which are missing. Okay. So the causes include trauma, dental caries, periodontal diseases, low education levels, poor oral health, low income, poor diet, and osteoporosis. What are the risk factors? So these aging. So with aging, your enamel will start to wear out. The gums holding the teeth, they can start to recede. But does that happen all the time? Yes or no? To some extent. But if you have very good oral hygiene, if you are properly flossing and brushing, then this process will get lessened or delayed. Smoking. Tooth loss is higher in smoking individuals because it causes gum diseases. Gender. Women undergo hormonal changes which can affect the oral health, making them more susceptible to tooth loss than men. So what is the impact on oral and general health? So when you don't have proper dentition, again, the same things that was there when you have a malocclusion. Lower confidence, lower self-esteem, difficulty to chew, difficulty to speak, difficulty to digest food or ingest rather. So there will be impaired mastication. It modifies the physiology of the mouth. So when your teeth is lost, the teeth are there in the alveolar process. Okay, the alveolar process will develop only with the teeth. If the teeth are lost, then that alveolar ridge is now known as residual alveolar ridge. This. Okay, when the teeth are lost, like you can see in the second photograph, we have the residual alveolar ridge. So what happens when you don't have teeth, your ridge resorption, your ridges will get smaller with time. Okay. Every year you will find that the ridges have become more smaller and more thinner. So how do we prevent tooth loss? So preventing is not always possible, but if we have a good oral hygiene routine, then definitely we will have better results. So brushing the teeth twice a day, flossing the teeth after every meals. In dental sealants are mainly used when the teeth has just erupted in kids. Okay, so with dental sealants, we are sealing their occlusal surfaces, the pits and the fissures. Avoid smoking as this leads to gum diseases. And we should visit a dentist every 6 months. So the treatments which are available for edentulism, it is dependent on the type of edentulism, whether it is partial or whether it is total. So if it is partial edentulism, means if your one or few teeth are missing, then we can provide them with partial dentures. Now the problem with these partial dentures are that they have to be removed. They are not fixed. So there is a wire part, there are clasps, and with the help of remaining teeth, these will be seated in the patient's mouth. Partial dentures. Then we can have, this is removable partial dentures. Then we can have fixed partial dentures, means bridges, in which the two adjacent teeth, they are reduced in size, and then a bridge or a metal 3 unit or 4 unit or 5 unit, it can be metal, it can be in porcelain, okay, is fixed. So the advantages is that it will not be removed on a regular basis. They are known as bridges or fixed partial dentures. Implants, as you can see in the last photograph. So when teeth are missing, so teeth has two parts, the crown and the root. Okay. So the root part can be replaced with the help of a titanium screw, which is known as a dental implant. So we have to first put the dental implant. We have to let it integrate with the bone, and on that, then a crown can be made. Dentures. So finally, if you have lost all the teeth, then a dentures can be made for the patient. So this was about malocclusions and edentulousness. If we have some problems, if we have some queries, we can discuss. Any questions? Yes or no? Yes or no? So I repeat this in every class. My teachers used to say, no questions means two things. Either, either, either you have understood or nothing. So I will take it that you have understood everything. Yes or no? Sure. Any doubts in malocclusions or edentulousness? No doubts? We'll take the roll numbers first and then we'll have a small quiz. Okay? And then those who can answer, I'll provide them with the attendance for today. Because I can see a lot of you busy with your mobiles, tablets, you know. So I think you can have understood everything. 1, 2, 3. Roll number 2. And no proxies, please. Roll number 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. Roll number 13, 14, 15, 16, 17, 18, 19. Roll number 20, 21, 22, 23, 24, 25, 26. Roll number 27. Roll number 27. Roll number 28, 29, 30, 31, 32, 33, Roll number 33, 34, roll number 34, 35, roll number 35, 36, roll number 36, 37, 38, 39, 40, 41, 42, 43, roll number 42, 43, 44, 45, 46, 47, 48, 49, 50, 41 was present, 51, 2, 53, 4, 5, 6, 57, 7, 58, 59, 60, 1, 2, 4, 5, 60, 67, 69, 70,